Hello, my name is Dustin Anderson. Today we're going to be talking about a few topics. We're talking about healthcare literacy, patient education, and telemedicine. So why healthcare literacy is important and what it is as clinical practitioners is important that when we find out what's going on with the individual that we not only convey the information to them but in a manner where they understand it. When looking at the United States, healthcare literacy is fairly low. The average adult in the United States is unable to read above an eighth grade level. And athletic trainers working in emergent settings could work with people that are over 65. And it's been shown that people that are over 65 have a fifth grade reading level. And a recent analysis of 31 of the HIPAA privacy notifications found that they were written on a second or third year college reading level. So HIPAA is pretty important when it comes to healthcare, and it's sort of shocking that it's written in a way that you have to have a college education to understand it. No wonder people are confused about what HIPAA is and what's going on. So we may be good at finding what's wrong with the patient, but we may be falling short on conveying it in a means that they understand and that it's meaningful for them. So what we really want to look at when we're looking at healthcare literacy and giving our patients information is we want to make sure that we draw attention to important information. If we give them a handout, even if it's for like lateral ankle sprains or if it's more for more chronic conditions, or even if we're in emergent settings working as a physician extender in a clinic, we need to make sure if we send them home with information about rheumatoid arthritis that they're going to benefit from that information. So if you're going to make a handout or if you're going to make information about it, if you want to draw attention to a particular note or something that's important, don't be afraid to bold or italicize at that point. Use 14-point size font. Make sure you use, the reason you want to do that, if we are working with elderly people, you want to make sure that they can see it and they can read it. You also want to use bulleted points to get the point across. Don't waste time writing a paragraph or anything like that. People are not going to want to read it. It's easier if you can just go down the line of what's important. Also, if something is important, make sure you repeat it multiple times within that so you can just drive home the message. You want to leave a lot of white space too. You don't want to make this too wordy, too flashy or anything else, and it also gives them the ability to write in it. And you can also use that white space to sort of like as a card. And if they come in and you're checking their blood pressure, body weight, BMI, blood glucose, all those little things, you can have that as part of the white space where you have the dates and they got to come back in and you fill those in. Using words longer than 3 syllables. Like I said before, like the average reading level is 8th grade, and if you get into the older populations, it's 5th grade. And if you're at a 5th grade reading level, that's just like functional literacy. That's basically enough to read, and that's about it. Length of the sentences should be no more than 10 to 15 words. And make sure, the reason you want to do that, you don't want to, again, bog it down with words. You want to drive home those important points. So the patient knows what they need to do. And write in an active voice. So make sure that make sure they can tell you what you've just told them back to you. And this goes into patient education. If we're handing them information that they're not getting any benefit from, we're really not educating them. We're just giving them this piece of paper and like, hey, take this home and read it and I hope it works with you and I hope you understand it. If it's a child, make sure the parents understand it. Before they go, you don't have to be rude about it, but just be like, hey, I've told you this, so you mind sort of just telling me, like paraphrasing and telling it back to me, what's going on, what we need to do. I think this will get the patient involved in their own health care and make them take ownership of it and would hopefully make them a little more likely to succeed in your current treatment plans. And again, if it's too wordy, too bogged down, too scientific, they're going to think you're talking over their head. They're not going to look at it. And you're not going to educate the patient with anything. Also, when you're working with adolescents, you need to make sure the parents know what's going on. You need to make sure the parents understand why it's important. They need to do the certain things that you're telling them to do. And don't get frustrated with the people. We're the ones in control. So I think if you definitely look at healthcare literacy and you take the things I told you into account, you'll be able to make good patient handouts or information flyers, whatever you need to do to communicate what's important that they need to do, need to follow your plan. Next, we're going to talk about telemedicine. This is a new and exciting extension of medical care. This allows for a greater utilization of medical care specialists, and it also is great for interprofessional practice and education. An attending physician can simply send a picture or video to another healthcare professional, and they can gain insight on what the patient may be suffering from. It may be a general physician sending it to a cardiologist, rheumatologist, any place that they need to send it to that's not their area of specialty. It cuts down on time. It cuts down on time to be seen by a patient by their healthcare professional. So, say they think there's something wrong with the heart, they can send the lab results to that physician, send them a short video to the cardiologist, and the cardiologist like, hey, try this, or send them on in, as opposed to waiting 2 to 3 weeks to see the cardiologist. And again, that will increase the diagnosis and in turn will increase treatment time, and hopefully decrease the time to when they're healthy. I just want to talk about how this could apply to athletic training. It could be great if we just have like a central station in the athletic training room, and that's connected to the team's physician office. Probably more than likely start in the ortho's office. This will again allow for good integration of interprofessional practice. And for example, say an athletic trainer has a question about an athlete and they don't know if they need to send it to the doctor or not. The ATC would be able to contact a physician, and they can look at the athlete. They can get the telecommunication center, and the physician can either look at the videos or the pictures that they sent, and be able to, hey, treat it in house or send them to us. So I think with keeping in mind healthcare literacy, patient education, and the new components of telemedicine, you'll be able to improve your clinical function and your patient outcomes well. Don't be afraid of change. Change never hurt anybody. But again, if you integrate those things in your clinical practice, I think it'll be great, and I think you'd benefit from it. Bye.